I see a lot of patients in my clinic with mitral valve disease, and they want to know whether or not their operation can be performed through a minimally invasive incision instead of opening the breastbone. Just to give you an idea of what this really means, the breastbone is a perfectly reasonable way to do mitral valve surgery, and 95% of surgeons in this country will perform the mitral valve operation that way. The problem with the breastbone is it takes 12 weeks to heal because it's a big broken bone. Although it doesn't hurt a great deal, 12 weeks before you can do any heavy lifting, get back to the things you want to do, go to the gym, play golf, that's a long time. And patients really don't like the idea of having their breastbone opened widely. Now, a minimally invasive approach to the mitral valve is a way by which we can do exactly the same thing that we would have done through the breastbone, but instead we do it between the ribs on the right-hand side. And this incision will be healed by the time you go home. You'll still be tired after heart surgery, that'll take a couple of weeks, but you will be healing up very, very quickly, and you will be able to get back to normal activity so much quicker. In order to assess you for minimally invasive surgery, we need to, of course, review the echocardiogram that you probably have had done already by the time you see us. This will give us a really good idea about the problem in your mitral valve. We will want to do an angiogram to check the status of your heart arteries to make sure that they are not furred up and diseased. And in addition, we would want to do a CT scan. Now, the CT scan is done firstly to look at the health of the rest of your body. And the main thing we're looking at also is the aorta pipe. If the aorta pipe is healthy, we know that we can put micropipes into your groin to perform the mitral valve procedure through the minimally invasive incision. One other thing that we do with the CT scan is look at the distance of a heart artery called the circumflex artery from the back of the mitral valve ring. Now, the mitral valve ring is like this, and there's your mitral valve, and there's an artery that sits behind the mitral valve, and this artery, if it's too close, could get kinked during the mitral valve procedure. And in order to avoid that, we can modify the repair if you have what's called a high-risk circumflex neighboring anatomy. So this simple test, the CT scan, will tell us all that we need to know about your suitability for minimally invasive surgery. Now, there are other things that we can do through the minimally invasive incision. We can do repairs or replacements of the tricuspid valve at the same time. We can do atrial fibrillation ablation at the same time, and we can close off the left atrial appendage. This is a little cul-de-sac in the left atrium where clots can form in patients with atrial fibrillation, and by clipping this off we can reduce the risk of you having a stroke. So all of this can be done through the minimally invasive approach. The main thing we need to do is assess you clinically, look at the nature of your valve problem, make sure your heart arteries are reasonably healthy, and do the CT scan to assess the distance of your circumflex artery from the mitral valve ring, and also to assess the health of your aorta and your organs in order that we can place micropipes into your groin for the heart-lung machine and the minimally invasive approach. I hope that's helped. There'll be lots more videos on the YouTube page and also on the website. Please go to the testimonial pages. They'll give you some reassurance and confidence about heart surgery, wherever you have your surgery, by the way, because today heart surgery is both very safe and very successful. See you soon.